Hello, everyone, and welcome to today's session. Hi, everyone, and welcome to today's session. I think you can all hear me now. Joining me today, it's wonderful to have you here. So, for those of you who Ashcroft, preparation provider, and I'm proud to say that I'm a OET preparation provider. I'm also a former me being here today is just to help you prepare for OET writing, particularly today as part of the All Stars team. So if you're here, it would be great for you to say a hello in the chat box and feel free to let me know where you're from and what your profession is and your test is, if you don't mind sharing. So I'm just going to start sharing my screen as those come in just now. Okay. It's great to have you all here from all different places across the world. So I'm going to start sharing today's presentation on OET writing, how to choose the right content. Okay, so let's begin. Let's begin. Again, thanks everyone for being here. It's a pleasure to have you. So today we're going to be focusing on OET writing and how to choose the right content for this, because this is a bit of an area of difficulty that I notice my students comment on, and I know that this is also an issue for other candidates. So hopefully by the end of today's session, there should be a little bit more clarity on this point. So I'm Joan Ashcroft. I'm from Ashcroft Medical English. And yeah, I just want to help you today and feel a little bit more comfortable with how to go about choosing content. So, in today's session, then, what are we going to cover? We're going to have a look at why choosing the right content is so important. We're going to look at what the right content actually is. We're going to consider how you can confidently choose the content for your letter. And at the end of the session, there'll be some time for questions and answers. At the end of the session too, before I forget, that there is a special offer that I want to share with you. Now, this is going to be for 50% off your first OET lesson with me, should you be interested in getting a little bit of help to prepare. I'll share the details with how to get your hands on that at the end of the session. There is limited availability, so if you are interested, I would get in there quickly. So moving on to the topic of today, the content for OET writing. So the first question that we probably should ask ourselves is, why is the right content so important? So of course, if you're here today, your top priority is going to be doing really well in OET writing. You want to pass, and hopefully with really great scores. So to get this achieved, you will need to make sure that the content of your letter is ideal. So if there are major errors with the content, unfortunately, this will lead to low scores. So we want to make sure this doesn't happen to you, because letters with poor content can't pass. Okay, so with that said, some more positive news. So once you have got the skills to write a really great letter for OET, the additional bonus is going to be that this will set you up perfectly for when you do start work in your chosen English speaking country. So all the work that you're doing now is just going to give you a fantastic foundation for a great start when you start work in your chosen country. Okay, so taking a closer look now at passing OET and how to do so. So, if we think about the writing criteria, we will then understand a little bit more about exactly how to pass. So the assessment criteria for OET writing are available on the OET website. So I would urge that you have a look at this. Now, they are divided into 6 different criteria: purpose, content, conciseness and clarity, organization and layout, genre and style, and language. Now, our focus for today is content. So this is what I'll mainly be talking about today. So here's what the assessment criteria look like in the document that's provided on the official OET website and that you can download. So it looks like this. You can see the 6 criteria listed at the top, and you can also see the band scores here. So we're all going to be aiming high, right? So for content, you're wanting to aim for a band 7 score. So this is the top score you could possibly get. So let's take a closer look at what's required to get that kind of score. So candidates who score top marks for content write letters in which the content is appropriate, and by that, appropriate to the intended reader. And it includes content that addresses what's needed to continue care. So all key information's included, no important details are missing, and content from the case notes is all accurately represented. So this is an example of what a writing test might look like. So this particular writing test is sample test 5 medicine. Okay, so it's sample test 5 medicine, which you can see in the official OET website when you search for sample tests writing. And of course, if your profession isn't medicine, you will see appropriate writing tests to suit your healthcare profession. Okay, so as you can see at the top here, your time for the test is divided into 5 minutes reading time and then 40 minutes writing time. So this 5 minutes reading time is really important so that you truly understand what the case notes contain and you really understand what is being required of you in the test. Now, an important thing to remember is that in this 5 minutes, you are not going to be able to underline or highlight the text. So you'll need to go back and do this as you begin your writing time. Anyway, so moving on, you can see that your notes are here. So these are like a pretend set of case notes. At the top of the letter, you'll have some important information to kind of give you the context for the case notes. And you can see here that as the writer, you are Mrs. Bennett's GP. You have been for 2 years, and you're treating your patient following a recent hospitalization due to cardiac problems. The case notes include all the standard details you would expect to see, and you can see more here. And then at the end of the writing test, you will see the writing task section. So here's going to have some really important information for you in terms of who exactly you're writing to, why you're writing to them, etc. So we'll talk about that in a little bit more detail shortly. So as you aim to score top marks for content, it's worthwhile asking yourself some questions. So you can ask yourself as you read through the case notes, is this information the reader wants? Does this information allow them to do what I'm asking of them? You can also ask yourself, have I included all of the information the reader needs, or have I missed anything out? And then finally, and really important, you need to make sure that once you've gone through the careful process of selecting the right content, that you accurately represent that in written form in the letter. So this is going to require you to be able to comprehend the notes well, and then to use your language skills to make sure that you represent that information accurately. So to sum up here, what we're aiming for is a letter that in terms of content has all of the relevant information, doesn't have irrelevant information, and that is accurate in terms of its representation. So if you achieve this, you're going to have a letter with great content. It's going to be a letter in which there is no important information missing. The reader will be able to do their job effectively. They will not be distracted by irrelevant content, and your message will be crystal clear. So let's pause for a moment and have a little bit of a think about what happens if you, as a healthcare professional, receive a letter that has missing information or which contains irrelevant information. Okay, so we can take a moment to think how that feels and what problems it causes. So take a moment to think about the impact of receiving a letter with missing information or a letter with irrelevant information. So maybe your thoughts are similar to this doctor here. Okay, so they may feel a little bit frustrated that they don't have the important information they need to do the job. They might be a bit confused and not be 100% clear on what is being asked of them. They may have the feeling that they don't have all the information they need and therefore need to go and ask more questions, which then takes up their time. They might also feel a little bit confused and be a little bit unsure as to why you're sharing certain information. It may not feel relevant to them. So these are things that we're trying to avoid by choosing the right content for your letter. So what is the right content then? Let's take a look at that. So as you're reading through the case notes, you'll be able to select the right content by thinking of the following things. So you're going to be thinking, right, okay, who am I writing to? Because that has a serious impact on what the right content will be. The content varies according to the reader. Then you'll need to be clear on why you're writing to them, because dependent on what you're asking of them, the content will again change. And then to be sure that you're getting this right, you can try and put yourself in the shoes of the reader and think, okay, so what would I want to know if I were receiving this letter? So let's have a look at the first question. Who am I writing to? So you're going to get this information from the writing task. So this appears towards the end of the writing test. And you can see for this example that you're writing to Dr. Banerjee, who's a consultant cardiologist. So in your letter, you know that this is the person you're going to be addressing, and the information is going to be chosen with them in mind. So you'll also need to be clear on why. So what's the purpose of the letter? So again, you'll get this information from the writing task. You can see that this is a referral letter to Dr. Banerjee, and what you're needing is advice and a review of your patient's medication. So now you have clarity on why you're writing to them, but to get the full picture, you'll want to understand the actual problem that you're facing. So you're going to get this information from the case notes. You get a nice little summary at the top of the case notes. And here we can see that your patient is experiencing cardiac problems and they were recently hospitalized. As you work your way through the case notes, you will obviously get further information on your patient's situation. It becomes clear that your patient had a heart attack. They went to hospital as an emergency admission. They needed to have a stent inserted, and they were discharged on the 15th of February. You can also see, as you work through the case notes, that a significant issue is side effects of captopril. So with this information, we're in a good position to start selecting the right information. As a final check, you can put yourself in the shoes of your recipient. Okay, so in this case, you are a cardiologist. Okay, so the reader, the person you are writing to, is a cardiologist in this particular example. So the problem is that the patient that you're being referred has cardiac problems. They've had a recent MI and they're having issues with medication side effects. You, as a cardiologist receiving the letter, are being asked for your advice and also a medication review. So in this situation, what would you want to know? Have a little think about that. So, as we select information, a simple thing that we can ask ourselves is this information relevant or is it irrelevant? So, relevant or irrelevant? Let's test this out. Let's have a look at the case notes and focus in on the social background and family history for Eleanor Bennett, the patient that is being referred to the cardiologist. Okay, so what are your thoughts then on this information? So we learn in the social background that Eleanor Bennett is a lawyer, specifically a commercial lawyer. She travels a lot internationally with her work. She's divorced. She has teenage children. Her children are not living with her most of the time. They appear to be living with her children's father, and there are issues with custody. This is causing the patient extreme stress. There are also there's also significant information here regarding alcohol intake and smoking, and information regarding her weight and exercise habits. We've got here information regarding her family history. Her father died at the age of 53 from a heart attack, and there were also problems with her older brother in terms of mental health issues. So, relevant or irrelevant to the cardiologist? Okay, so we have to think about what the cardiologist needs to do their job. And what you've requested is for the patient to be given some advice and also for a medication review. So if I were to highlight the notes, this is what I might do. So this is what I would do after the 5-minute reading time. I would select things that I would consider of relevance somehow and work out how to incorporate this in the letter. So these are the things that I would highlight. I think the issues in her social background are relevant to her health condition, with her having cardiac disease. The social impact of these issues on her condition will be significant. The family history is also important. Obviously, there's the family history of cardiac disease at a relatively young age, and another issue regarding the family situation, which will add to the stress that the patient is experiencing. So here, what I've put on the screen is the main body of the sample letter that comes along with this sample test. So in this sample letter, which you'll see on the OET website, if you're interested in having a look at the full letter, you can see how the relevant information has been incorporated. You can see how this information here regarding the patient being a commercial lawyer with frequent international travel has been included, but in a summarized form. Really, the most important information is her occupation, as everyone appreciates that this can be really quite a stressful occupation. So, in terms of the alcohol intake and the smoking history, again, they're focused on the main points here and really highlighting the number of units and how many cigarettes are being smoking. They have chosen to exclude this information here. With this information, the cardiologist has the most important information they need to know. Of course, for a cardiologist, the patient's BMI and exercise habits are of interest. And we can see here how the family history of cardiac disease has been incorporated, as well as the mental health problems that her older brother has been experiencing. And they've included that in this paraphrased form. And in terms of the family situation and the divorce, this has been included in a really quite concise form. So no unnecessary detail has been included. Moving on then, let's have a look at medications and treatment on discharge. So this is another section in the case notes that I've chosen to focus on to get your thoughts on whether you would consider this relevant or irrelevant for the cardiologist. So here we can see the medications and treatment that the patient has been given on discharge. So here we can see the medications, including the dosage and frequency. We know that she's been referred for cardiac rehabilitation, but unfortunately she's not been attending. And counselling has been given regarding lifestyle changes. So if this were me, having a look at the notes, I would consider all of this really quite important. So I'd want to make sure that this information was certainly incorporated in the letter. In the sample letter provided on the OET website, this is how they have chosen to use the information. So you can see here that both the medication, the dosage, and the frequency is included. Now, this is really important for the cardiologist. They are going to need to review this medication, so they need all of the details regarding her medications. The mention of lifestyle changes that have been advised is incorporated, and the cardiologist is also given the information regarding the cardiac rehabilitation referral and the issues with non-attendance. So let's have a think then about common mistakes. So there are common mistakes, and I would love it if you would be candidates that can avoid these, because I just want you to perform the best that you can and have an excellent score in the test. So let's have a look at some common mistakes that can be made. Okay, so there's a simple thing that you can do, and that's like I mentioned earlier, is just simply highlight and underline the relevant content in the notes and make sure you do this after the 5-minute reading time. So if you don't do this, the problem is it's just too easy to leave out key information. So the other thing to think about here is that we want to make sure that as you select information, you're definitely keeping the reader's needs in mind. So if you don't select the information based on the reader's needs, the content score will be lower. Equally, you don't want to include anything that's irrelevant. This can become quite distracting and can lead to a bit of confusion on the reader's part. And finally, once you have chosen what you want to include in the letter, you're going to be going to need to be really careful that you represent that information accurately. So you interpret the notes accurately, and that linguistic errors don't cause any sort of misrepresentation of what those notes are actually saying. So, if anyone has any questions they would like to ask, I'm happy to answer those rather. Okay. Okay. So, let's see what we have here. Okay. Oh, I can see that there have been a few issues in terms of audio and the screen perhaps being blurred. Well, I do hope that those issues have been resolved. If not, what I will be able to do is make available a recording of this session. I'll do my best to fix that problem if it has been an issue for you. So I'm having a look at the chat box. I'm having a look at the chat box. Okay. What if I'm not sure of relevancy? Okay, so one question here. What if I'm not sure about relevancy? Right, okay. So this is where it can become um, a real benefit to be able to place yourselves in the shoes of the recipient. So if you so you have to think about it in terms of, well, if I were receiving this letter, would this information help me or not? Is the information helpful so that I can do my job? Or is it just a distraction and information that, okay, may be of interest, but is not actually going to give me any more information that's going to help me in terms of the context of the situation, or provide information that's going to let me take the next step to continue effective care of the patient? So I hope that helps give a little bit of clarity on that. Putting yourself in the recipient's shoes is a key, really, to determining relevance. Okay, okay. So I have another question here about paragraphs and the length. So no, the paragraph length is just needs to be appropriate. So it doesn't matter if the paragraphs are different lengths. Inevitably, they will be actually. So some paragraphs may be as short as one sentence, some may be longer, and that's okay. Really, it's about accurate paragraphing and making sure that each paragraph relates to a specific topic. Okay, so we're running out of time now, unfortunately, so I'm going to have to start wrapping up. But if I haven't been able to answer any of your questions, what I would urge you to do is get in touch with me, okay? You can contact me via my email address, okay? And I'm going to leave that on the screen for you at the end of this session. So, in terms of getting help to prepare, so if you feel that you need a little bit of help along the way, help is absolutely advisable. A little bit of guidance as you prepare is going to make a big difference. So if you are looking for help and you're interested in getting a little help from me, I do offer OET preparation packages, which you can find out about on my website. I do offer one-on-one and VIP training sessions where you've got complete flexibility in what's covered in each lesson. And I'm also now offering group lessons on request. So if you have a group of friends, colleagues, family that want to all learn together, then get in touch and we'll get something arranged for you. So, okay, so your special offer. Yes, before I forget, if you would like to get a 50% discount on your first OET lesson with me, then you can do so by going to this link, and I'll put it in the comments, okay, so that you have access to that. And what else did I want to say? Yeah. So this lesson will just give you a taste of what it's like to learn with me. If you are interested, I'd recommend booking quickly because I do have limited availability. So I hope to see some of you with me in there for a trial lesson. Okay, so thank you so much for being here with me today. I truly appreciate your time spent with me. I do hope that you've had some value from the session. Next time, I'll be talking about OET speaking, and that session will be on the 24th of July. So take a note of that and join me if you can. And if you can't join live, then you can at least catch up on what's been shared with you in the recording of the session. So I'm really excited about this next session that I'm going to be hosting, because in it I'm going to be sharing with you 4 important questions to ask when giving information. Now, this is important because it's going to really boost your clinical communication skills score. Anyway, I've gone over time, so I will say goodbye for today. Thank you again for being with me. You can get in touch with me through my website, email. You can also contact or connect with me through Facebook or LinkedIn. It's been great having you here today, and thank you for being here. Bye bye.